Hi, I'm Michaela, and this is my roommate, Charlotte.
Hi.
We're sharing a room here at the hospital, and we decided we'd be each other's moral support.
Yeah.
So I just wanted to introduce you to her, and see you later.
Bye. Hi. So my last chemo treatment finished a few weeks ago. However, I'm still here at the hospital because my medical oncologist wants me to get radiation therapy because chemo didn't work all the way. The tumor's still here, my left eye. So I'm going to be doing brachytherapy, which is a type of radiation therapy. Basically, they have like a little plaque, which is like a container, and inside are little radioactive pellets. They're going to sew that to the tissue around my eye, and then that should cook the malignant cells. An ophthalmologist saw me earlier, and they said that my tumor isn't really near my optic nerve, so I should be able to keep my vision. So that's good news all around. Most of you are probably wondering about what cancer treatment is like, so I'm going to bring you along. Is it okay if I film you? Okay. Hi guys, this is Maria. She's my medical oncologist, and she'll be doing my surgery today for inserting the plaques, so should be fun. Okay, so it's the day after surgery. I got my fancy new eye plaque. It's gonna be in my eye for about 6 days, then they're gonna take it out. Should be a great time. Sorry if I'm super out of it. I'm on pain meds, and yeah, my eye still really hurts though. It's like sore all around, especially if I try to like roll my eyes. So maybe I'll stop doing that because it hurts. Hi, I just got the eye plaques out. You can't tell because I'm wearing an eye patch, but trust me, it's not there anymore. I got them out after 6 days, which is about typical, I think. My eye is still sore. There's nothing new in that department. But yeah, I should be getting discharged in a few days. So, excited for that.
So my first round of chemo is today. I'm pretty nervous, but who isn't? So my treatment plan right now involves me undergoing chemotherapy to reduce the size of my tumor with the potential for surgery in the future. Fast-growing types of bone cancer are often treated with chemo before surgery. This is to try and reduce the size of the tumor and to try and destroy the tiny areas of metastasis if some cells have spread. Usually several drugs are given, like 2 or 3 or something. And right now I'm taking cisplatin and doxorubicin, but I know Charlotte took like eptoside, isofamide, and doxorubicin. Most chemo treatments are given in repeating cycles. So the rough schedule for me right now includes 2 cycles of chemo and then a reevaluation to see if it's working. My cycle right now involves 1 dose given weekly, and I most likely will have several cycles of chemo. I'm also going to have to get a lot of lab tests to try and make sure my liver, kidneys, and other important organs aren't completely dying. They're called complete blood count and chemistry panels, and the blood count measures white blood cells, red blood cells, and platelets, while the chemistry panel just measures blood chemicals. Also, if you're wondering what this weird lump under my shirt is, it's a port. I had surgery to put it in. It's basically a small disc made out of plastic or metal that sits right under the skin, and my chemo medicine is given through a needle that goes right into it. I also can get blood drawn out of it. And so my life right now is basically revolving around drugs. Not that kind of drugs, though. Right now, I'm taking anti-nausea drugs to try and reduce the future side effects of chemo. Along with that, I'm also taking anti-anxiety medications because my treatment is so intense. These are all trying to make my treatment not as bad, but cancer is still pretty bad. So this is basically what happened with my first chemo treatment. I'm demonstrating on a really creepy hospital doll, which I don't know where it came from, but it probably came straight out of a horror movie. So, a couple weeks before, I'd gotten a port implanted subdermally. You can't really see it, but it makes chemo easier for me. I have a huge fear of needles, and it makes the procedure painless. So, step 1 is to put this pretty mask on to prevent infection. Step 2 is to sterilize the port site. Tony feels for the side of the port to make sure that he's poking at the right thing, and then sterilizes it. Step 3, they check for blood rerun. They put a covering over the port site, and once it's on, they covered, the mask can be removed. So they check for blood return when they first insert the needle. And then we move on to step 4. Side note, I recommend not to wear a high-necked thing so they can access your port better. Step 4, they then flush the line and put some heparin in it, which is an anticoagulant, so that the next time they access it, the port isn't clogged. They then draw blood or give me any medications. With chemo at first, I could smell and taste the initial drugs. They gave me Benadryl, steroids, and relaxers. Step 6, they then start pushing the chemo drugs. Step 7, after this round of treatment is done, they then deattach the port, and I go back to my room.
Refreshing.
Cancer Vlogs, now sponsored by Gatorade.
Okay, so it's been a month since I was in hospital. I went back for a checkup today, and they said that my tumor was shrinking, so that's awesome. My vision is worse than before, which is fine, I guess, because I can still see and I still have my eye. It's just pretty blurry in my left eye. I need glasses now, as you can see. I can see clearly only when I have glasses on. The bright side is that I'll look super smart all the time, right? And my favorite part of radiation is that I didn't lose my hair. I was super self-conscious about that when I got chemo before I got radiation, but it's all good now.
Well, that's good, but I'm kind of the opposite. Chemo's been coming along. I can't get the flu shot this year because chemo is currently killing my immune system, so hopefully I don't get sick. Hopefully I won't fall too far behind at school in my classes, but the short-term side effects of chemo are nausea and vomiting, so I'll probably switch to more online classes. If I fall behind, I'll just use this summer to catch up.
Oh, that sucks. I'm already back in school.
I wish I could, but in the long term, chemo causes like fatigue, difficulty with focus thinking, chemo brain, and like some problems with internal organs. Maybe it's good that I'm not going to be at school. Anyways, spring break is like next month, and my friends promised to at least try to contact me.
I'll never leave you.
Aw, thank you.
Are you ready to lose your hair?
Is anybody?
You can borrow my bandana. I don't have lice, I promise.
Thank you.
Bye.
Closet never